So, to Justin Trudeau, Dr. Bonnie Henry, Dr. Tam, and Dr. Ted Ross. The DSM-5 symptoms for PTSD for a diagnosis. Criterion A says refers to exposure of actual or threatened death, serious injury, or sexual violence. These can either be directly or indirectly. I have 4 years in an intensive care unit with 3 patients, and Fort St. John per capita has the highest birth rate in Canada. Northern Health did not fund the nursery. There is no neonatal intensive care unit. There is no staff for the nursery. There is no on-paper funding for the nursery. We had the equipment. This means that when this pandemic, for me, and this gets into criteria B, includes intrusion symptoms. These may be recurrent or intrusive memories or dreams. May include flashbacks. For me, when this pandemic starts to infiltrate schools, I relive the children whose lives I saved. From brand new newborn to kids to teenagers. I relive those moments where a child today is still alive because I went into work in a whiteout blizzard. There was no doctor there, but I was there. I remember some truly horrific ICU events when we're dealing with a pandemic that requires people to be intubated. The House of Commons has witnessed this. And that's the thing I keep trying to explain to the House of Commons as I've been tweeting, is you are actually witnessing all of this happen. But you all seem to think this is some political game that I am playing when I'm not. This isn't anxiety. This is pure frustration. Now, the part that's really difficult for me, Prime Minister Trudeau, is your Minister of Finance profits off of violence towards women. And we are still in 16 days of activism, where at the conclusion we remember the Polytechnic massacre of 14 women, 1 administrator, 12 engineers, and 1 nurse. 31 years we have remembered that this has happened, and for 31 years we've forgotten the nurse. I look to the Conservative Party and say, you were in power and you had the 2004 Health Accord. And in British Columbia, nurses face higher amounts of violence than law enforcement. We have language through WorkSafe regulations that are an expectation of the job that the employer makes violence prevention plans. Now, if the violence across all of nursing in British Columbia has been steadily increasing, with Bill Morneau profiting off of the legal fight at WorkSafe, saying that violence is an expectation of the job, claim denied. Just think about that. You're a nurse in prolonged social isolation, working alone with 3 patients violence, people going through acute withdrawal, people who need to be crash intubated because it's an ICU still. We still do that stuff. Doctors who are at home, you might get a break, you might get to pee with the door closed. Violence is an expectation of the job, claim denied. When we have violence regulations, where the expectation of the job is that the employer, which is the BC government, follows them. There is also regulations within WorkSafe BC that state that the employer must fill out check-in logs when an employee is working in isolation, which means social isolation, not infection control. This was not done, nor has Northern Health produced these documents. Failure to produce these documents indicates that the evidence is that Northern Health did not do them. Again, I was told it does not matter. This was a brand new built work site. We transferred to a new hospital. The sewer was not connected underneath the staff elevator, and Pyxis was a BC government pilot project. I was in the ICU, the first ICU in British Columbia to go 100% on Pyxis. At 8 a.m., the Pyxis would lock. I would be unable to access any newly ordered medications since pharmacy was last in the building. And sometime around 2 p.m., I would be able to give my patients their morning medications in an ICU. I had doctors yelling at me about Pyxis. I had no support from anyone, and I met with my MLA. I explained the violence. I explained working alone. I explained the BC government pilot project to the Minister of Agriculture at that time, who sat back in his chair at the end of a substantial meeting and said, "I've been in business a long time, and you are not going to change that." I asked for a second nurse on shift so it would be safer from the violence, so that when we had people going through acute withdrawal from whatever, it doesn't matter, it was a lot safer that there would be two of us. That when a patient coded, there was someone to grab the crash cart and someone to start CPR at the same time. That we could get breaks. That we could actually go to the bathroom and leave the door closed because we were monitoring the patients at the same time we were peeing. Does this sound like this ever met labor law? Does this sound like anxiety? Do I look like depression? No. I have severe PTSD, and I have been advocating for changes to healthcare, for an increase of nurses, for a very long time. John Horgan went on camera outside of the legislature and said, "Stop, there's enough nurses." They were talking about the Vancouver Convention Centre being a field hospital if needed. Are you sure we have enough nurses, John? John Horgan spent $8 million to start a new agency to combat the violence in healthcare. They're spending $8 million for an agency to turn to the BC government and tell the BC government to follow the BC government WorkSafe regulations. So why doesn't the BC government just follow its own regulations? We have a feminist prime minister and the best man to be prime minister in Canada right now, in Justin Trudeau. But Justin Trudeau, you have to make a choice here. You cannot claim to be a feminist and continue to ignore what Bill Morneau has profited off of. You cannot advocate against violence against women when your former Minister of Finance profits off of violence against nurses. Canada is having to use the army for vaccine distribution. We're having to call on the Red Cross. We're having to build field hospitals. What happened to the $41 billion in the 2004 Health Accord? Why don't we have any staff? Where are the nurses? How come Morneau Chappelle got $1 billion for Site C and I couldn't get a second nurse? John Horgan, how much will Site C cost the BC ratepayer and taxpayer with a new foundation that requires new permits? And from Trans Mountain, we know that those permits must undertake meaningful consultation with First Nations. This is Treaty 8 territory. Canada has a treaty that says healthcare services. My ICU in Fort St. John, we had the internist, which meant I had the obligation to Canada to make sure those services were open. So it could be a whiteout blizzard, no plane would be landing. But that ICU was open if I was there. There was always a nurse in that ICU when I was there. As this pandemic gets worse, as the outbreaks in schools get worse, as we see more people dying, this is going to be harder on me. And it's already extremely difficult. What the BC government is engaging in with me is mental torture. So I am asking the Canadian government to respect a nurse with severe PTSD. To say to Justin Trudeau, send Paul to St. John's so he can heal. John Horgan, you have a majority now, and it is the expectation of the voters that you actually reform WorkSafe BC. It is my expectation that now you fix this. I am severely mentally damaged from the actions of WorkSafe BC throughout my claim. Severely mentally damaged. I cannot work in this pandemic. I have a hard enough time trying to buy groceries with people not wearing a mask. I get overwhelmed. And as I just explained, I get intrusive thoughts of children who are trying to die in my care. I meet all of the DSM-5 criterion for PTSD. While there is an attempt to force me back to working in healthcare somehow. I can't cope with the thought of being the grocery store clerk right now. And I was an ICU registered nurse. One puff of medical marijuana, and you can see the difference in me. Prime Minister, why is Canada not more concerned that British Columbia doctors refuse to prescribe medical marijuana, which we have had a constitutional right to in Canada, where the Canadian Supreme Court has ruled multiple times that denying someone access to medical marijuana in Canada violates their constitutional rights. Why do I have to beg for my life? Why do I have to make videos now so you can actually see how distressing this is? I was in prolonged social isolation. You have to understand that if you're a nurse, you're like a member of cabinet in that you can't talk about what happens. I'm going to make another video now and talk about the psychiatrists.